Good afternoon, everyone. I'm Naomi Mathis, Associate National Legislative Director with the DAV, and today we're going to talk about the House Women's Veterans Task Force, give you some updates on the Deborah Sampson Act, and a couple of other women veterans issues. So let's first talk about the new motto. The new motto at the VA has been changed. It used to be to care for him who shall have borne the battle and for his widow and his orphan. In VA's efforts to really make it an inclusive environment for women veterans and really every veteran, it's been changed and the new motto is to fulfill President Lincoln's promise to care for those who have served in our nation's military and for their families, caregivers, and survivors. And if you don't see that in your VA yet, it is coming. Women Veterans Task Force has been reauthorized, and Representative Brownlee out of California, Representative Rattawagen out of America Samoas are the co-chairs. And if you don't know, Representative Brownlee's Democrat, Representative Rattawagen represents Republican side, so we have a bipartisan task force. First roundtable is going to be on Thursday, April 27th. I will be there, and it'll examine the potential barriers to benefits women veterans may face in the VA disability claims process, as well as barriers to care within the VA medical system. If you have any questions or any issues that you want to bring up regarding those topics that you would like brought up at the roundtable, please feel free to email me at nmathis@dav.org, and my email will also be at the end of the presentation. So not for public consumption, this is just kind of a little gee whiz for our BPTLs. VA is sponsoring a Women Veterans Summit in Los Angeles, and it looks like it's going to take place in March of 2024. The planning is coming. The details haven't been set in stone yet, and they definitely have not made the announcement yet. However, DAV will absolutely be in attendance, and DAV's actually been a participant in this Women Veterans Summit for quite some time. So it's not unusual for us to be there, but we will keep you updated as we know more. Our VSO and IVF work groups continue. We are in constant communication with the other VSOs, VFW, PVA, SVA, all of them. We don't always agree, but we all work really hard to ensure women veterans get the benefits in first-class, gender-specific healthcare they have earned through their military service. More broadly discussed topics are in the IVF work group. However, it helps. There are stakeholders on the call who give us information on where certain lawmakers stand on the issues. So it's really good for us to be in the room. There is some current women veteran specific legislation that is out there. HR 544, the Veterans Infertility Treatment Act of 2023, says that the VA shall furnish to the covered individual infertility treatments. You probably are familiar with this from last Congress. It's been out for a couple of Congresses already and has been reintroduced again. It allows for 3 completed in vitro fertilization cycles that result in live birth, or 10 attempted IVF cycles, whichever occurs first. It also includes donated embryos and gametes, and also defines the word partner rather than spouse. HR 894, the Equal Access to Contraception for Veterans Act. Both of these bills are bills that were introduced by Chairwoman Brownlee. This bill prohibits the Department of Veterans Affairs from requiring copayment from a veteran for any contraceptive item that is required to be covered by health insurance plans without a cost sharing requirement to the veteran. And then we have companion bills out of the Senate, S1028 and HR 2441 for the House, the Service Members and Veterans Empowerment and Support Act of 2023, also known on the Hill as the MST bill. It's to improve access to VA disability benefits and healthcare for veterans who experienced military sexual trauma. As we are gearing up for National Convention, we have invited the Director of Center for Women Veterans, Lourdes Tiglau. She will be our guest speaker for the Women Veterans Seminar. And then, back by popular demand, those that were in the workshop last year, we had about 200, I think, attendees. And that is Toni Hightower. She will lead the My Journey workshop. Again, we've invited her, and we're really, really excited about that. We're also working on one more guest speaker for the Women Veterans Seminar. So now let's give you some updates on the Deborah Sampson Act. The Deborah Sampson Act, if you remember, was the most comprehensive piece of women veterans legislation on women-specific issues that DAV had been fighting for quite some time. So here are some sections that we're going to cover right now. You might know the Deborah Sampson Act also as the Johnny Isakson and David P. Rowe Veterans Healthcare and Benefits Improvement Act of 2020, and this came out of the 116th Congress. So section 5107A is the child care for certain veterans. So it says that the secretary shall carry out a program to provide, subject to other subsections, the child care assistance program. It's a two-pronged program, and it allows the VA to provide child care for a veteran that has a health appointment. And so the two-pronged attack basically is, one would be called VA Kids Care, which is drop-in child care at the VA Medical Center. And then there's also the direct veterans reimbursement for improved licensed drop-in child care services in the community. Now, out of last Congress's Women Veterans Task Force, we kind of were really pushing for the reimbursement aspect of it. And that is because there already is limited space in a lot of VA medical centers. And, rather than have or give up clinical space for a drop-in child care, it may be easier for the veteran to get child care within the community, and then the VA would reimburse the veteran. It's basically kind of like a voucher system. So still more going on with that. They're also working on their IT infrastructure. 5202, this section authorizes an appropriation for VA Women Veterans Healthcare Mini Residency Program. And so DAV is a huge champion for these mini residency programs, and it is to, so last year in fiscal year 22, the Office of Women's Health held 3 national mini residencies, and they trained 422 primary care providers and 215 nurses on women's health issues. In fiscal year 2022, the Office of Women's Health achieved a milestone of training over 10,000 VA clinicians in the Women's Health Mini Residency Program since its inception in 2008, and that is huge. The Office of Women's Health will also continue to execute additional training in order to meet the Deborah Sampson Act requirements that came out of that law. 5203, the VA must establish a training module for community providers, and that is non-VA healthcare providers specific to women veterans. So we also know them as community care providers. And so 775 community providers enrolled, 464 have completed the training. They've gotten some good feedback on that. The Office of Women's Health will continue to disseminate the training through VA channels and continue to expand the reach of this training by exploring partnerships with medical professional societies and other federal organizations. This is something that we are really pushing for, particularly when it comes to suicide prevention. We believe that community providers really should be getting similar training as the VA providers are getting in-house. 5402, subject matter experts have developed barriers to care survey questions to address the 11 barriers to care that you may see here: driving distance, availability of childcare, things that the Deborah Sampson Act has really tried to they've tried to cover every area that could possibly be a barrier for a woman veteran to receive care. And of course, at the bottom, you see the perception of the motto of the department, and obviously that has changed. So in public law, against the Deborah Sampson Act, 5102, we're going to talk about that, as well as 5103. 5102 is retrofitting existing medical facilities with fixtures, materials, and other outfitting measures to support the provision of care to women veterans at such facilities. So basically, the plan will include an explanation of the specific environment of care deficiencies that need to be corrected, making, again, these facilities more welcoming for a woman veteran. There are some that have experienced MST that aren't able to be in a mixed gender area, and so maybe a separate entrance. And so this allows or appropriates about $20 million for this to be carried out. And here's a big number for 5102, $666 million as a 5-year capital investment. A lot of numbers here. Basically, they are working on retrofitting the facilities to make sure that their women's health clinics are welcoming to women veterans, and just the general facilities in general. 5103 requires the VA secretary to establish a policy for the environment of care standards and inspections. So this includes the alignment of requirements, such standards and inspections, such as the health handbook of the VHA, delineation of roles and responsibilities of staff at each medical center who are responsible for compliance, the requirement that each medical center submit to the secretary and make publicly available a report on the compliance of the medical center with the standards, and a remediation plan. Now, fun fact, this picture, just one guess where it is. Anybody? I'll tell you. This facility was a VA medical center that was started in 1851, right after the Mexican-American War. And this facility just was abandoned in 2016. This still exists. Where is it? It is in the nation's capital. It's in DC. So it sits on, I think it said, over 500 acres. So, it's kind of like, all right, what's happening there? And up to the beginning of 2023, they still were trying to figure out what to do with the facility. So hopefully there's more to come on that. So 5103, bottom line up front, the handbook. VA says that they've actually updated the handbook and have provided the information to, actually, let me get there. They've provided the information to Congress in their congressionally mandated report. 5304. So there's section 5303, 04, 05, but really this is just covering the intimate partner violence and sexual assault areas of the Deborah Sampson Act. So this required a 2-year pilot to assess the feasibility. The pilot is done. They really hit the ground running. I got to tell you, this office, whenever we get briefed on the intimate partner from the Intimate Partner Violence Office, they really have beefed up their personnel. They're using their resources really well. And of course, I put the white ribbon. We will be having white ribbons at National Convention if you come to the Women Veterans Seminar. we will provide white ribbons for you. So those that didn't get any, you will get one. I know that that was a really big popular item, and really it shows that you stand with saying no to being sexually harassed, catcalled, assaulted, or anything like that at VA medical centers, really in general, but at VA medical centers in particular. It should not be that you walk through the door and hear, "Hey, gorgeous, how you doing?" or anything like that. And I tell you that because I've experienced it. So these sections, again, intimate partner violence office really hit the ground running. I don't have the other ones on here because it kind of is all encompassing, but I will say that VA has hit all of their goals when it comes to the IPV and the sexual assault, really components of the Deborah Sampson Act. So this focuses really on the development of veteran-facing educational materials, staff, community partner training, data collection, community engagement, ongoing pilot site consultation. And it just goes on, and really it can even go even further, and we would like to see that. Here are the pilot sites. As you see, it's a mixture. There are some urban sites, some rural sites, and even as far as the Pacific Islands. So they really try to get a mixture of areas. So implementation, there are two programs, one called IDEA, the other one called iSave. And again, they are doing really, really well. The only thing is that they were supposed to establish a task force, and the task force was delayed for whatever reason. And but in accordance with that, they will begin planning. It says early this year. We're kind of in the middle of this year, so I'm going to try to get some updates on what's happening with that. But also, so that's not done, and they have something called now Research 2.0. There is the research component of the pilot program, and that is kind of, so based on the information that they got out of those, it kicked off a Research 2.0. So it kicked off more research. So as they were getting data, they realized, you know what, we can get even more data. What about this? What about that? And so we're really happy to see that. We're all about the research, because how else are you going to know how to treat veterans if you don't know what's happening within the community with what research data points? So also they have given, let me go back to the previous slide, a brochure for men who have experienced intimate partner violence was also distributed to all 10 sites for use. So it's not just women veterans specific, and because as we know, men can be assaulted as well. Next steps on the implementation of the pilot, conduct more visits, finalize and distribute educational materials for Native American, Hispanic, African American, LGBTQ+ veterans who have experienced intimate partner violence or sexual assault. Of course, that's, key, and those are some high risk populations within the women veterans cohort. 2 podcasts, it says 2, there actually are more coming. If you have Spotify or Apple Play, or I'm not really sure what the names are, but anyway, if you listen to podcasts, you will be able to find the VA's podcast, and it's actually pretty cool. People are responding really well to it. You probably have also seen in your local VA the whiteboards displayed at VA facilities that make it more, kind of easier to report. In other words, pointing the veteran in the direction of, hey, this is what you have to do if you have experienced intimate partner violence, sexual harassment, sexual assault. This is the number to call, or this is the website to go to, or there's even a QR code actually. I know here at the DC VA medical center, there's a QR code that you can just hold your phone up and hit the QR code, and it'll take you right to the website where you need to go and give you all of the information. So the launch started in March of 2023. And again, same as with the motto, if you have not seen it at your local VA, doesn't mean that it's not there, it's coming. Now, let's talk to some commanders, adjutants. I would love for you, if you have not seen this page, you should have, and you should. This is if you have a Women Veterans Advisory Committee in your state, or if you don't and you want to start one up, this is where you would start right here. The Women Veterans Advisors Guide is on our website, dav.org. Go to Veterans Topics and Resources, and the Women Veterans Advisors Guide is in there. It has links, it has, here's next steps, here's what you need to do. And of course, I'm always available if you have any questions. Joy is available if you have any questions, but really the information is right there for you. If you don't have a Women Veterans Advisory Committee, I highly, highly encourage you to do that. We are the fastest growing cohort within the veterans population. And so it's extremely important. There are some states that are doing some amazing things within their women veteran community, and I highly recommend it again. So just some news that's coming out of, let's see, we have news out of Louisiana. They have a Women Veterans Informational Conference on May 18th at 9 o'clock at the Doubletree Hotel in Kenner. If you don't know where Kenner is, it's in New Orleans. And so if you want to sign up, the information is there. Space is limited to 75 attendees. Also coming to your local VA hospital, you'll see the new wraps on the shuttles. They're celebrating 100 years that the VA has been providing gender-specific care for women veterans. Again, my name is Naomi Mathis, and I just want to say thank you so much for those of you that have reached out, that are really interested in women veterans issues. You don't have to be a woman veteran just to be interested in the issues. And it's extremely important. Again, we are the fastest growing cohort within the population. And again, if you have any questions, please feel free to reach out. Thank you.